Hello, nurse leaders, nurse faculty, academic folks. My name is Nikki, and I am a nurse coach and consultant, and really a health equity expert. And I'm here to talk to you today about how we can practice equitable care in the community. So, my question to you is: do you think one semester of public health courses and theory and even practice in nursing school is enough? I have talked to a few nurses, especially nurses of color, about ways in which we can create equity in community. And their feedback to me has been that they don't get enough opportunity to actually practice health equity with community members. And so to me, this indicates that we have to do more when it comes to thinking about how do we actually practice equity. It's not enough to say that we understand it, and it's not enough to tell our students that it needs to be done. It needs to be modeled and demonstrated. So, nurse faculty really do need to create more opportunity for community engagement in nursing schools, experiences of communicating with patients in their space, right, where they're comfortable, where they feel good, and to practice, even most importantly, decentering, right, yourself as the person in power and centering community members as those who have voice and choice. So that's an exercise to teach nursing students how to practice centering others. And this can be done in a variety of ways. And I'd like to share just a few of the ways that I do this with my students. So some of the ways that I help them to practice equitable care is I teach nursing students how to actually do care coordination. And I know you're like, wait a minute, aren't there people that do that? Absolutely. But what I've learned is that if we don't help them understand now what care coordination is really all about, then later they won't understand how it applies to them. And care coordination is really all of those different factors that offer that support system for our patients who are living in community, living with complex illness. So, giving them practical ways to actually do it, such as making phone calls, checking in. Another thing that I really like to do is create opportunities just to be in community. So this may look like disseminating flyers for a community-based organization or a nonprofit organization. It may look like just walking around community and talking to folks that are there, getting to know, or as we call the windshield survey, right? Getting to know community. And I know the windshield survey can be controversial for some. Share your thoughts about that as well. But even things like assisting with HIV testing and blood pressure screening and monitoring, which are common things that we see when we're having our students in community spaces. But this allows for interaction and relationship building between community members as well as community partners. And this is an important skill if we want people to practice equitable care. So, I'd love for you to share with me, what have you tried? What are some things that you have done when it comes to trying to teach our nursing students and our future nurses how we can strive for health equity? Please share some of your comments or your thoughts in the chat. I look forward to continuing this learning journey with you. Thank you.